Hello class, this is Tulio. Week 5, and this week we're talking about healthcare. And so we're going to talk about the Patient Protection and Affordable Act, otherwise known as Obamacare. Some of the remarks from President Obama that I read about. I guess he mentioned that 30 million don't have health care in the U.S. Quite a few people. Another thing he mentioned was that by 2014 all Americans should have insurance of some type, either through their employment or individual insurance that they can get, or through the exchange. I guess that's what they call the insurance policies that are going to be provided either through the state or the government, and then the state can flex some of the policy provisions so to match the state's needs. Other things that I read on CNN Money, they said that about half of current individuals' plans or individual insurance plans will have to change by 2014 because they don't meet the Affordable Care Act. That's very interesting. So it seems like they raised the bar, or they've added some provisions in there that currently they're not meeting the standard. They also said that about 15 million or 6% of non-elderly adults will be affected, which they currently have individual insurance, so that could potentially affect them if they're buying individual insurance that doesn't meet the standard. So by 2016, according to CNN Money, 24 million people will have exchange insurance, which is the one that's provided by the government, and approximately 12 million will get individual coverage to cover that group of people that don't have insurance. Some of the changes that I saw that are pretty significant were on the provisions that for the minimum standard with the medication, maternity, mental health, and also they've thrown some religious, cultural things out there, like contraceptives. So there's a lot of stuff involved in the provisions. Now, what's interesting is that there are some penalties for the individuals if they don't get the minimum coverage. So I think it was about $95 per adult, or 1% of their adjusted family income. So based on the premiums that you want to get, you're either going to pay higher coverage, or you're going to have higher out-of-pocket costs. So it depends what kind of premiums you want to get. Now with that, the federal government is going to subsidize for individuals that cannot afford the minimum coverage if they meet their standards. So it's like 400% above the poverty line, and that equals out to $45,000 annual income for individuals and about $92,000 annual income for married couples. Now, according to the text, from what I've read is, and we've seen it, a lot of people cannot afford insurance, so they just don't get it. So now with the Obamacare, they're going to have to get insurance and meet the minimum standard. The text says that healthcare costs are just in the rise, especially in prescriptions, Medicare, Medicaid. The rise in the cost is for individuals and for the government. So there has to be something done. The healthcare cost has to be reconsidered, and you just see if it measures up to the three measurements of a policy: effectiveness, efficiency, and equity. Some of the provisions that I've read, and I didn't cover all of them, are individual mandate, so that covers everybody. Also, everybody is guaranteed an issue of insurance regardless of previous medical conditions, sex, age. So I guess effectiveness is that they're trying to get everybody to get online with individual insurance. Now if they can't afford it, then the government is going to provide some subsidies to the states, to companies, and to individuals, so they can get on board with this. So efficiency, they're trying to get there. Another thing is that the government, with these provisions, they've kind of phased it out. Beginning with 2010 all the way to 2020. So the effectiveness of it is they're not trying to push everything on at one time to everybody, because they just can't make it happen. So phased out is a good way of doing it. Guarantee insurance for everybody. Individual mandate, so you have to get it or you're going to be penalized. So there's some equity there. They're trying to get everybody, to include the corporations. Now for large companies that have 50 or more employees, they're going to have to pay for insurance for the employees and get some government subsidies. Now for smaller companies, it's not going to get subsidized based on employees, but if they're able to purchase the exchange insurance through the government, then they'll get some subsidies. Now when it comes to all this, it seems like efficiency, effectiveness, we still have to see, but it looks like it's going to reduce some of the costs. And then it's equity, it's covering a lot of people. It's just the question to me is, how is it going to get funded by the government? If the costs are rising for individuals, for the government, how's it going to get funded? So what they're going to do is they're going to tax, and they're going to have some offsets. So they're going to tax pharmaceuticals, high cost diagnostic machines, and also, for example, like tanning. So there's a lot of things that they've thrown in there for the provisions that they're going to tax. So that's some of the funding that they're going to get. They're also going to offset it. So they're going to reduce some of the healthcare costs. They're going to reduce hospital costs, and they're going to reduce some of the policy costs involved in the whole healthcare realm. Well, that's all I got for now. Do some more reading, some more research. There's a lot of provisions, a lot of phased out manner in which government wants to implement their healthcare, this Healthcare Affordable Act, Obamacare. But we'll see. As far as if it's going to work, you have to see long range, the effectiveness of what they're trying to do, where they're trying to get to. But it looks like equity, efficiency could be there. All right. Thank you.